Good afternoon, everyone. You're very welcome to today's event. My name is Maeve Fogarty and I'm going to be your host for this afternoon. I'm the Healthcare Development Manager looking after the Tena range of products with Bunzl Cleaning and Safety Supplies. Also on the call with me today, I'm delighted to announce we have two members of the S&T team, and I also have my colleague Anya, who is the Marketing Manager with Bunzl Cleaning and Safety Supplies. So from the S&T team, we have our main presenter, who is Janice Matthews. Thank you very much, Janice, joining us today, who is the Account Contracts Manager, and we have our colleague Ian Daniels, and thanks to Ian too. You can give a little wave there from the side, who is the Account Sales Executive, who will be happy to help us out later on in the event with the question and answer session. So at this point, I'd like to extend a very warm welcome to everybody who's taken the time out of their busy schedules today to attend the event. We're very grateful for your attendance today. I'd like to just quickly run you through how the event is going to run through the agenda, and then we will start. So firstly, what we're going to do is share a video with you, which highlights the benefits of choosing Tena as a brand of incontinence wear, and it really shows you the huge amount of research and development that goes into developing this brand. And there's a reason, I suppose, for it being the market leader and a premium brand on the market. It also will tell you the importance of skincare, and Janice will also elaborate on this point throughout her presentation after the video. So without further ado, I would like to go to the video clip. Just before that, I would like to say, could I please ask everybody to have their screens on mute? Thank you.
Economies around the world are facing the challenge of an aging population and the strain that puts on healthcare resources.
At Tena, we are committed to finding better ways to care for the elderly, not shying away or hiding aging. Elderly skin has been through so much over the years, a lifetime of experience traced onto the skin. And as the skin gets older, it gets thinner, more fragile and slower to heal. At Tena, we know that with incontinence, skin can be further compromised. Working with healthcare professionals and caregivers has shown us that incontinence care and skin care are inherently linked, and that taking care of skin health is one of the biggest challenges they face. That is why we are on a mission to provide better care for elderly skin, drawing on our 50 years of expertise and our pioneering innovations. Asking and listening has taught us that the most important principles in maintaining natural skin health are keeping the skin dry, clean and protected. So now Tena is introducing the Pro Skin range, designed to deliver these benefits and is accredited by the Skin Health Alliance. The Pro Skin range is offered in a simple 3-step skin health solution. Step 1. Our absorbent products offer triple protection for dryness, softness and leakage security. Step 2. Our pre-moistened wet wipes gently clean. And step 3. Our creams provide extra protection. Every time you use our products, you're not just managing incontinence, you're actively helping to keep the skin healthy, providing comfort, helping to prevent pain, preserving their dignity, and making you feel proud that you're providing the best possible care. Put simply, better skin health is better for everyone. Tena Pro Skin.
Thank you very much, Anya, for running that. I think that video really encapsulates what Tena is about as a brand. I hope you enjoyed it as much as we did from our end. Now I'd like to once again to hand you over to Janice Matthews, who will present to you on women's health today and incontinence. Thank you very much. Over to you, Janice.
Okay, thank you, Maeve. Can everybody see the screen okay? Is that okay at the moment? Just checking, yes. Yeah. So good afternoon, everybody. Thank you for tuning in. We're very grateful. If you've been here before, as I say, I'm Janice Matthews. I worked for Tena now for the last 10 years. please make it a wee bit interactive today. Tell us where you're watching from, who you are, and if you've even been here before. So we're just going to take you through a few slides for the next 20 minutes. We're focusing on the women this time. We started with the men. So we're just going to go through some of the more common ailments that affect women and how to treat them, and then look at some of the treatment options from a Tena perspective, and then we'll introduce you to our academies. So, so yes, next about 10, 15, 20 minutes or so. So now we'll just go on to the next slide. Okay, that's the next slide. That took a while. So ladies, in the wise words of Dolly Parton, sometimes it's hard to be a woman. And the reason I started with this slide is over the years I've sat in with our continence nurse specialists, and they would all collectively say research has shown that it takes about 5 years for us ladies to find the correct healthcare professional, the right product, the right treatment option. So this is not good enough. So this is something that we want to talk about. We shouldn't be suffering in silence. We shouldn't be just putting up with it. We shouldn't be told it's normal after children, you know, to have stress and incontinence issues. This is not normal. So 5 years is not good enough. So we want to just introduce this to you as nurses, and I'm a nurse now 30 years. This is something we should actively engage with, I think, when we're speaking to our patients, whether we are in the home care setting, whether we're in outpatients, A&E, hospital, anywhere at all, we should be engaging with them to say there is help, there is something that can be done here. And at a very good level of hope, 80% of treatment, 80% of patients who attend for treatment will be completely treated, cured, or at least managed very well. Some of the units that I work with have over 90% treatment success rate. So there is something that we can do for you. So yes, we wanted just to then, as I say, this slide I had shown last time, there is a huge prevalence, and these slides go back to, they're 10 years old now. 14 million people in the UK are affected with some bladder or bowel issue, and that's 1 in 5, 1 in 6. I would say it's more. I would say it's 1 in 3, 1 in 4 of us are affected at some stage of our life, whether this is children to old age, it doesn't matter. So there is something that we can do to help our clients, and this is something that we're very proud of at Tena. We work very much in partnership with our healthcare professionals, with Bunzl, because we want the best possible outcome for our patients at the end of the day. The biggest one that seems to come forward within primary care is the stress urinary incontinence. And this is the one that so many people make jokes about, the trampoline jokes. The trampoline should be banned. Stress urinary incontinence. This isn't actually a bladder issue. It's more an issue with the wee urethra, the sphincter at the bottom. So this is all about the pressure. This is all about the pressure exerted, the intra-abdominal pressure. So as the pressure increases above and overcomes the wee sphincter, that's when we get little droplets of urine. So this is a weakness really of the pelvic floor. There are many different reasons for this. So this is probably the most common presentation to a general practitioner or a nurse prescriber, nurse practitioner. We do have a lot of continence nurse practitioners out there, which is absolutely brilliant. So about 40% is what we'll probably see. I would say more. So they'd say 1 in 3. I would say it's 1 in 2, if not maybe everybody of a certain age. So stress urinary incontinence is what we see quite a bit of it. These are some of the causes of stress urinary incontinence. Clearly, obesity, there's a lot of extra pressure pushing down on the organs. So even 5 to 10% of body weight can make a huge difference. I worked in obesity doing clinics years ago, and even just a stone, half a stone, anything at all will make a huge difference here. And again, some of the wards we've done trials in over the years, respiratory wards, that chronic cough, that constant intra-abdominal pressure has put an awful pressure on our pelvic floor. Again, I think when it comes to anything any type of incontinence is a symptom of something else. We should seek help first and foremost. See our GP, get referred to the appropriate person. Let's not make it 5 years, because any of these types of ailments can destroy marriages, relationships, jobs, you name it. And the emotional stress and the depression, the quality of life that comes with it is huge. So let's be more active. Let's ask a lot more questions to our patients about this. Incomplete urethral sphincter muscle. This is something that needs your dynamics urology teams. So there's so many specialists out there that can help. Again, in women after childbirth, it's not the norm after childbirth to have a weakened pelvic floor, but this can certainly contribute to it, especially multiple pregnancies or carrying more than one baby. And clearly the menopause is to blame for everything. It's the estrogen effects that can cause some of these symptoms. And again, it can happen with men as well. Post prostatectomy, there is quite a high incidence actually of urine leakage, so that can take a while. We talked about that the last time in the last webinar. Sometimes it can take, depending on the extent of the surgery, it can take up to 6 months sometimes to get our gentlemen dry again. And that's what we're always aiming for. We're always looking at the cause, seeing how we can treat it, and then how we can go from there. There are many different things that actually can help, and this was like, I couldn't believe it when I started 10 years ago. I didn't realize there was so much that could help women, men, everybody out there. And I've been to many, many different conferences over the years, and some of the really good conferences that I would encourage you to attend would be the Association of Continence Advice. It's an all Ireland meeting. And it meets actually in Dublin twice a year. They'll bring in all these specialist speakers and they'll talk about many different aspects of continence management. If you're interested, just put a wee link in the question and answer and we'll get back to you with the details about ACI. But over the years, I used to think it was surgery, it was tablets, there was something else that was so much better for treatment options. Stress urinary incontinence responds really well to pelvic floor exercises. And that surprised me. I've heard professors of urogynae, they've all said the same. It comes back to the basics. The basics can nearly treat the majority of what is out there. So pelvic floor exercises, just as a disclaimer, anybody that's embarking on them should actually see either their doctor or their specialist nurse to actually get an internal first to check there's no prolapses or anything abnormal. And also they should be taught by a properly trained rehab nurse or a rehab physiotherapist. So that ensures that the exercises are done properly, correctly. And every time I would do talks, people have been telling me all the wrong ways of what they've seen online. So that's why we would always encourage people to go and seek professional help, because this will actually make a huge difference. There is so many different treatment options. Say treat the cause. If it is the weight, the intra-abdominal pressure, let's identify the weight. Let's treat the cough if that's a problem. Estrogen replacement is quite an interesting one. And as we get older and to go premenopausal, postmenopausal, it's actually the lack of estrogen. Estrogen's quite important. That's what keeps everything nice and plump. And so as we reduce our estrogen, it reduces the thickness of the vaginal and urethral mucosa, and that's what then can cause sometimes some of our stress urinary symptoms. So there is different options out there, and again, speak to your GP or whoever. And surgery is normally the last option, and there is cases of whereby I know in one of the places is about 4% maybe will go for surgery. They've tried everything else, there's nothing else. And electrotherapy sounds quite harsh. Electrotherapy this helps to contract and stimulate the pelvic floor, and again this is done usually with a specialized nurse, but everything else would be looked at first. So this will help to strengthen and tone the pelvic floor muscles. So there's so much more that can help, and please let your patients know wherever you're at, there's so much more that we can be looking at. They shouldn't be waiting 5 years and walking around even with a product on. There's so much more that we can do. And if if again this isn't treated early enough, sometimes the first presentation is the skin, and the skin's nearly like urine burnt, and they're using the wrong products, etc. So that's where I would see sometimes quite a few patients with my clinical nurse specialist. So stress urinary is more the pressure. It's not really like a bladder issue. The urge urinary incontinence. This is one they don't know exactly what causes it, but there's many different causes. So the deltousor muscle, which sits around the bladder, this is where the problem starts. This is what misbehaves, and the deltousor muscle is there to squeeze out the urine. So when the bladder fills up to, our normal bladder is about 400 to 600 mils. When we get older, the capacity is maybe 350, 400 mils. So in normal conditions, we'll get the signal to go to the toilet. When it's appropriate, we go, and it's the deltousor muscle that squeezes out the urine. And the bladder's actually never completely empty, just by the way. There can be up to 100 mils of urine in it, which otherwise the bladder would stick together, quite frankly. So the problem with urge urinary incontinence is the deltousor muscle. That's what's misbehaving. So you have two different types of urge, and it's like overactivity is what we normally would call it. So it's overactivity wet or overactivity dry. So that is the difference of getting the urge to go to need to go to the toilet, and when you get there you pass 3 drops, or when you get the urge, your deltousor muscle completely goes into spasm, squeezes the bladder, and you just empty your complete bladder there and then. It's horrendously distressing for patients. And so again, this is something that needs a really thorough investigation and good assessments. It's also responsible for a huge amount of falls. So if you're watching in from the hospitals or nursing homes or anywhere like that, falls are predominant. People are trying to get out of bed, they've got the urge to go, they're tripping over their slippers and whatever else on the way out, and this is what ends up with fractured neck of femurs, etc. So as a risk management, it's something to be part of the assessment as well. So the urge is more the deltousor muscle misbehaving and playing up and over and squeezing often. The normal voiding pattern for normal people is somewhere between 4 to 7 times a day. For someone with urge, this could be every 20 minutes, every 30 minutes, 15 minutes. And these are the people that go to the toilet before they go shopping. Then when they get to the shopping centre, look for the toilet. So they're always in a state of anxiety looking for the toilet. At a positive level, there is so much that we can do to help our patients right now. And one of the biggies actually is caffeine. And we are a nation of tea drinkers, and probably more recently coffee drinkers, and it doesn't take much caffeine per milligrams. It takes 4.5 milligrams per kilogram of body weight to stimulate the diuretic effect of caffeine. Your average cup of coffee is about 80 milligrams, and that's just your average cup. That's not your double shot or all these fancy ones that you can get now. So caffeine is something when you come in, and this is an issue for any of your patients that you're working with, reduce the caffeine down to 2 to 3 cups over the 24 hours. That's absolutely more than enough. Chocolate, it has loads of caffeine in it as well, so be kind with the chocolate. So, and alcohol as well. Alcohol's a diuretic, it's just going to make you pass water. So these are things that your patients can simply do just at home right now, and this may actually just be enough to reduce that irritation that's causing this overactivity. And again, the flip side of this is when the patients end up being seen in clinic, what they're finding is they're not drinking. So they're too frightened to drink, they're not drinking tea, they're drinking nothing, so they're getting concentrated urine, and that concentrated urine, quite frankly, is burning the inside, the mucosa of the bladder wall. So that's actually irritating the bladder even more. So so the best thing for our patients is for them to drink more bland fluids. Lemon, barley water seems to be the fluid of the moment. So more water, more bland fluids, and just less caffeine. And I say, when you ask most people, they've probably already 3 to 4 cups of tea or coffee in them by lunchtime. So that's going to act as a huge stimulant. So, and usually when they come into the clinics, they've got their Coca-Cola, their Boost, Monster, they've got something with caffeine in it. So these simple measures can make a huge impact to the patient. Constipation as well. There's a slide that'll show it a wee bit better. A full impacted bowel will put a lot of pressure on the bladder, therefore it can't expand and contract properly. So this is going to cause a lot of irritation and any conditions affecting the lower urinary tract. And that's why we want to see, that's why our nurses, our doctors want to see our patients. There could be something like a tumour in the bladder, maybe one a week is what I hear, what the specialist nurses would say. The red flag for that would be blood in the urine. Again, it could be frequent UTIs. That happens a wee bit more as we go postmenopausal as well, and as we get a wee bit more older, sometimes that can happen as well. And there could be stones or wee calculi, something like that. So we need to investigate it thoroughly because I'm sure it's horrendous to live with. And again, it's a mixed bag here. So anything neurodegenerative, Parkinson's, MS, stroke can make a huge difference here. So again, we're treating the cause, we're looking at the diet, we're looking at the whole patient, the whole assessment to see how we can help. And as I said there, we do need to look at the amount of irritants, especially in nursing homes. When we go in, we're always saying more bland fluids, that'll make a huge difference. That nighttime cup of tea is what could have them up 3, 4, 5 times a night. Some of the decafs are good, but you need to check your decaffeinated. One of our nurses did her master's looking at decaffeinated beverages. Some of them were up to 80% caffeine, so you nearly need to phone the manufacturer. If you're going to pay 3 times the price, just check the decaf and just check what actually the milligrams of caffeine is in it. So you could actually swap a few of them for your decaffeinated drinks. And as I say, medication, working in partnership again with our pharmacy community, some of our medications could be causing this urgency, overactivity, etc. And there is medication that you can take for it as well. You can see there for the constipation, you can see that enlarged, that bowel. It's going to push on all the other organs, which is causing, firstly, discomfort, no doubt, and again, irritation. The bladder can't expand and contract properly. And more water, simple as that, just simple messages all the time. And there are many different interventions that are being used. And behavioural modification, bladder retraining is one of the big ones that they use. So this person that's coming in every 20 minutes, getting that urge to go, they're generally saying, make it up to 30 minutes, 40 minutes, an hour, 2 hours, etc. So it can take up to 3 to 6 months to get your patient bladder retrained because there's probably a mixed bag of anxiety here, and they've probably had that one incident where the bladder has emptied spontaneously on them. So bladder retraining, bladder remodification, this will help a lot. Again, pelvic floor training as well is important as well at this stage because you've probably got a mixed bag of stress and urge probably going on as well. So it does no harm to strengthen that muscle. Some of the newer treatments like Botox has been an interesting one. Botox has had quite good success actually, and with Botox, again, this would be for people with a strong urge to pass urine that has not responded to simple drugs and medication. So the Botox injections can help relax the bladder. Generally, day procedure, well tolerated. However, with Botox, it wears off. So somewhere between 4 to 9 months. And I've spoken to people that have actually had it. The first 2-3 times were great. It seemed to be just not as effective after that. But 1 in 10, 1 in 20 patients may need to end up self-catheterizing after a Botox treatment in the bladder. This is one of the side effects of it. So, but for people that get it and it works, it actually works really well, and they respond well to it. Medication, there's a lot of newer anticholinergics. Again, this just dampens down that excitable deltoids muscle. So again, there's just specific criteria, contraindications. It can give you quite a dry mouth. It's contraindicated in some of the cardiac diseases. I do believe there's newer ones with less side effect profiles. But again, for the people that take it, it's just such a life changer. And again, with even any of these treatments, you're always always looking at all the other things we can change, more bland fluids, managing constipation, you know, etc. Acupuncture has been an interesting one. Some of the clinics run these and they get a certain amount. I don't know, everybody's individual, if it's private or public here, but acupuncture stimulates the sacral vertebrae. So this has a suppressive action on patients with this overactivity. And for the time that the patients are getting this type of treatment, it's very effective actually. So it's something that can actually help. Electrical stimulation, this is a more sophisticated form of like biofeedback used for pelvic floor muscle rehabilitation. So these are just stimulating different wee muscles to try and support all of the functions. So there's a lot of treatment options for our patients, and that's what we want to encourage and give them hope that there's something out there. So that's why it's so important to get our patients ask the questions. And that was a study that they were initiating a few years ago. I don't even know what the outcomes were, but they were actually phoning randomly round patients who had been outpatients, hospital, anywhere at all within some of our trusts, and asking, did anybody address bladder or bowel issues with you during your time in your hospital unit? And they were finding a very low response rate because either we're embarrassed or patients are embarrassed or we're not hearing. So there's a lot that we can do to help is what we're saying. And you can just about see those wee figures there. So quite often stress urinary incontinence, probably around 40–50%, urge urinary, because there's a whole catalogue of issues that could be going on there, 14%, and then you'll clearly have a mixed bag of everything going on in between. So there is things that can help these issues, and do keep asking your patients, how can we help? How can we help them? At a level of what I've been doing for the last 10 years with the company, where we come in is we want to support you with choosing the right product for your patients. And 10 years later, I'm still doing that. And our product assessment, we've different product assessment sheets. So what goes in must come out. So that's quite right. We'll put them in a fluid balance type for 3 to 4 days, see what's going in, what's coming out, and then we'll choose an appropriate product plus whatever other treatments that they're getting at the time. What I wanted to say, and I never knew this working on the wards for years, the technology behind our products, we buy high-grade super absorbent powder. So this basically absorbs and locks the liquid away. So this powder that you see just at the top of the screen there just sits mixed within the fluff pulp, the virgin pulp, and that's what locks everything away from the skin. Because if incontinence issues are not managed properly, the skin will break down very quickly. So it's a high quality super absorbent powder that you're paying for. And again, this is a huge part, and a lot of people don't realize the technology that goes into the products. Again, product assessment, that's something we'd go into more detail, but it's everything, it's holistic. And even in line with your HICWA requirements, we've individual sheets to show that your patient in your nursing home has been assessed. They're assessed every 6 to 12 months, and they're in a product because there is a medical reason. And our products are actually deemed a medical device. So I suppose legally speaking, there should be actually an assessment for product. And when we are looking at some products along some of these issues like stress urinary incontinence, the Tena Mini range is suitable for some of these patients while they're undergoing treatment and where treatment has failed and this is management. There are some products that will manage for the future. The Tena Mini Comfort comes in 3 different absorbencies, and you'll see there 150, 250 and 400 mils. So there's different, so that's for urine absorbency. And even considering what said earlier that the bladder capacity, even when we hit over 70, is about 400 mils. You can see how much these products actually hold, and it's because of the super absorbent powder. They've got a wee sticky back, put it into nice, good, snug fitting underwear, and this will give you the security that you need. There's a lot of odor control with it, so there should be no odor, and you'll be able to get on with your normal activities of living, as I say, while you're undergoing treatment options. There are some other different types of products we have in the Tena Comfort range. As you can see from the absorbencies in the wee grey bar, our products can go up to, we've even higher absorbencies in this. So there's 5 of a choice, from 450 mils of a urine capacity up to 1300 mils. And quite often, as I have a wee wander around the hospitals back in the day before coronavirus, I often seen high absorbencies being used in people for just stress urinary incontinence. We don't need this level, we don't need this capacity. So this is why we're here. Maeve works with Bunzl. She's here to guide and advise you on the type of products to actually use. So the Tena Comfort is a 2-piece system with different absorbencies that fits into good fitting underwear. And again, the Tena Fix Premium range has many different sizes. There's actually an extra small as well, I forgot to put in there. So extra small up to 3XL. And they're a multi-wash, at least 50 washes. And again, if you're working in a nursing home, residential home or something, you can write the person's name on a permanent marker. So they're individual to your patient. The biggest bit that I never realised as a nurse on the wards is all the products had wetness indicator lines except the minis. The wetness indicator line, as you see, before use is yellow. And what that means is when you see yellow on that line, that means that there is no urine leaking back onto your patient's skin. Your patient's skin is dry. So you can wait until the line turns blue, 2/3 or 3/4, and that will give an indication to change. If it's soiled, of course it's changed immediately, but the line is there to guide you as to how much of the product is used or being used, and it stops us unnecessarily waking patients up in the middle of the night just because we think we have to change a product. So the wetness indicator lines are there for a reason. They'll give us a guide as to when to change, and anybody with children knows all the new kiddies products have wee lines on them as well. There's also Tena pants as well. Again, as you can see, when it comes to Tena, we have a lot of sizes. We have different absorbencies and we have different products. So that's where we're here to help you. And again, pants have different criteria in different parts of the country. They can be used to help support people's independence, keeping them maybe in their own home, maybe early dementia or for whatever. There's different retail products as well. Sometimes some of the products we do are a wee bit different to what you'll see in the chemist. So they might be just less absorbent, but we've got 400 mils to a litre in the Tena pull-up. So they're your complete pant with the product inside. Again, how to get the best from your products, that's what we will do training with you about. Again, no excessive use of creams or talc. Anything that is a barrier between the patient's skin and the product will block the effectiveness of the urine being pulled through. So we don't recommend talc in the product or any excessive use of creams. Any oil-based creams can actually put a layer of like oil on top of the product, and that might be stopping it working effectively. As I've said before, all these products are deemed a Class 1 medical device, and therefore they should have an assessment. And HICWA will love you if you have all your medical assessments, all your single sheets done up, justifying why you're using a medical device on any of your clients. And again, we always encourage not to store them in bathrooms. The super absorbent powder works. So if the bathroom is an active bathroom that's being used by a lot of people, it'll just basically suck in the mist and the dampness of the environment. So just keep them in their packet in a bedroom or something. No double padding, and that was something that's still out there. We still see a lot of double padding. We don't need it. One product for one patient, and that's why they're a medical device. We wouldn't be using 2 catheters or 2 stockings, etc. So it's a medical device, one product, one patient. And as I say, we're here to support you as to what type of products for your unit, your ward, your home care nursed patient, because they have all individual sizes, individual absorbencies, and as I say, we've so many products now, it's hard to keep up with. Everything that we do is about creating good skincare, and The super absorbent powder and the pulp just keeps everything away from the skin, avoiding any damage, any fungal infections, bacterial, moisture associated lesions, continence lesions. I hear so many different terms for it now, but good continence care will equal good skin care, and that's what is so important. And that's where the high grade super absorbent powder will lock it away completely from your patient's skin, and especially as we become older and the skin's more fragile, it's so important to have really good skin care. A lot of what we're doing now, because life's a wee bit different, is I wanted to visually show you this more. We have a Tena Academy. If you are a Tena supplied area, home, hospital, we can get you access to the Tena Net. And TenaNet has everything on it about our products, and it has a message board, loads of interactive things, and it'll also take you on to our academies. There are 7 modules that you can do. They're CPD accredited, and then you can print off a certificate from that. So if you're interested in that and you're a Tena user, we're happy to provide that. We also have a YouTube channel. You can go on and look at specifics of fitting. If you need to show your caregivers or family members, they can go on and have a look. We also have we launched the Facebook actually just back on World Continence Week in June. So we have the Facebook community as well. And so there's lots of bits and pieces there. We're also considering as well, we also have 1 to 1.5 hour academies, which we do. Normally before this it was face to face, but now with technology we can do it online. So if you had protected learning time in your home or ward, we could zoom into you and we could do a 1 or 1.5 hour looking in more detail at the A&P and looking in more detail at all the treatment options, because today's sort of like a quick run through, just gives you like an oversight of everything. So so please ask us any questions, tell us where you're listening in from, whether it's reflective or not, let us know. And thank you for listening. Thank you very much. And I'll just hand the screen back. I'll stop sharing.
Okay. Thank you very much, Janice. That was a really, really comprehensive session. I always pick up lots of tips from you myself, so thanks for that. No, really, really thorough. And as you said yourself, the more we discuss this topic and the more we talk about it for you guys as clinicians out there in the field, it'll, it gives you more opportunities to learn about updated products and treatments for patients who are dealing with incontinence. Because as you say, the numbers and the facts and figures are there. It's going to affect either someone very close to you or yourself at some stage in your lifetime. So it's really key to discuss this topic. So thanks again, Janice. At this stage of the event, obviously I'm conscious of time. We normally just do a quick question and answer session, and I am going to hand over to Ian in that respect. Sometimes we have questions in from the attendees, or sometimes we'll just talk about frequently asked questions that would come up to us on a daily basis. So Ian, I'll hand over to you now, if that's okay. Thank you.
Hi, thank you very much, Maeve. Basically, I work for S&T in the Care for Business team, so nice to meet you all. Great presentation, Janice, so thanks again for that. I think there's been a small technical hitch with the actual question box, guys, so I think that'll be available for the next webinar, but I think for today there was maybe a slight issue with that. But I have had some questions emailed directly, which has been great, so I'll just go through the first one, which is: what services do Bunzl in Ireland offer to customers for incontinence help, and what resources do you have? So just wondered, Maeve, is that maybe something you could help us with?
I can indeed. Thanks for that one, Ian. Yes, as I mentioned earlier in the presentation, I work as the Healthcare Development Manager, but I'm also the Nurse Advisor. So I just, the title is quite long, but I'm very much hands-on with regards to offering any kind of support to hospitals, care homes, nursing homes out there. Obviously, up to a few months ago, we would have done that in person, but now, as Janice said, we're more than happy to share our educational tools online. So I can do, I can help you through phone calls, we can set up Teams meetings, whatever works best for your facility. But and also just to further expand on Janice's point with regards to your protected learning, we will be setting up one of the clinical consultant team from Essity to offer virtual training sessions, which would be quite comprehensive, maybe an hour and a half at a time. That this you could fit into your schedule. We can put them in maybe 6 weeks in advance, depending on what your needs are, be it. We talked obviously today about women's health, maybe men's health. It might be general with regards to product choice. But for every day-to-day, question you might have, please don't hesitate to pick up the phone. I'm only delighted to be here to offer our services. We have some really good product assessment tools, that will guide you. And because Janice said herself, actually picking the correct product is key to the outcome for the patient. We also I'll be delighted to provide you with some samples. So any samples you want, and after today's sessions, please just, as I say, pick up the phone or drop me an email. I'll certainly be on hand to do that. Thanks for that question, Ian.
Perfect, thanks Maeve. And just had another one through, which was quite an interesting one, which was from one of my other customers, which says, what's the quickest way, Ian, we will know what Tena products to use for different incontinence situations? So I think you sort of went through some of that, Janice, but if you can maybe just elaborate on that, that'd be fantastic.
Yes, depending on the clinical environment. If it was a nursing home, we would have like a core nursing home list. We would bring in different assessment sheets, different products, and we would streamline the products that we feel is more suitable for your environment and suitable for your patient needs. So A&E is going to be different from elderly care or a stroke unit or an orthopedic ward. So we will individualise everything for your staff members, and it's actually quite an easy process. We're here to help you.
Perfect, thank you. And I've just had another one through as well, that's just about how do customers go about ordering samples. So I think if maybe in this instance, Maeve, if anyone's got sample requirements to contact you directly, and then from an Essity perspective, we can support you with that.
Absolutely. Yes, from our end, Ian, just give me a call or send me an email at any point at any stage, and I will organise the samples. And we can also do follow-up training or beforehand, or send out some literature to support the samples as well, whatever is appropriate. Perfect. Ian, thank you very much.
My pleasure.
Really appreciate you taking the Q&A today, and thanks to you, Janice. Once again, I really hope that everybody who's attended today has enjoyed the session. I've certainly, as always, as I say, pick up a few tips from Janice, who's got a wealth of experience in the field. I'd like to say thank you to my colleague Anya for being the producer of the event today. And as I said to Janice and Ian, we will be having another event. The date we have in our diary will be September the 15th. So please keep your eyes peeled. We will have the details to follow in the next few weeks, and we will let you know what the topic will be as well in the next week or so. So thanks again for taking the time out today, and we really appreciate it. Thank you. Take care now.
Thank you. Bye-bye.
Thank you. Bye-bye.